Hi, this is George Kutnarian. I'm Senior Vice President of Public Policy and Legislation with SixBeds, and we are doing our legislative update for this year. I'm joined by our legislative advocacy team, Bob Naylor and Roxanne Gould, and the three of us together comprise your legislative advocacy team and public policy team, and we're off to a busy start. Coming out of the pandemic, and things are kind of improving now, and there's a lot of bills that we're tracking and that are going to be of interest to you, and so we want to provide this update to educate everyone in our membership about what's going on and what are the bills that we're tracking. And you'll, with this email that you've received to view this webinar, along with it you'll notice a contribute now button. I just want to explain what that's about. We're basically looking to help raise funds to support financially our legislative advocacy efforts. SixBeds, like any other similar organization, has been impacted by COVID. Many of the in-person events that we would typically do to raise funds to support our operations, those events did not materialize, obviously. And so we're looking for your support. If these bills that we talk about are interesting to you, you believe that they impact you, then if it's in your heart to contribute to help support our activities, then please do so. Any contribution is important to us, and you can make a contribution regardless of what your membership status is. So if you're already a dues paying member, great, we appreciate additional support. And if you're not a dues paying member, we ask you to consider that, but also notwithstanding any of that, you can feel free to make a contribution to support our activities regardless of your membership status. So with that said, I will pass it on to Roxanne, who will kick it off for us.
Okay, thanks, George. So I guess I want to give an overview of where we are in the legislative session. We just started the first year of a two-year session in January, and nearly 2,400 bills have been introduced to date. They could go through this year into next year. And I mean, to George's point, there's a saying in the legislative process that if you're not at the table, you're on the menu. And so we are trying to protect SixBed members from becoming targets or victims of maybe there ought to be a law contest, or people who had a negative experience in one particular small situation, but they want to attack the entire industry. So we watch every bill that's introduced, we watch every bill that's amended throughout the process to try to make sure the bills that can help you thrive and grow go further in the process, and to try to stop or amend those bills that could have negative consequences. And so one of those bills is a bill by Assemblymember Vopel from Santee, and it involves creating the electronic monitoring in an RCFE Act. And it basically authorizes the use of electronic monitoring devices in a residence room. And I imagine most, if not all of you, when you hear that, you think how many hurdles, obstacles, problems, threats that could cause. While well-intentioned, I suspect, it results in huge privacy concerns for the resident. It results in possibly people listening in on private conversations between family members. It results in a resident's neighbor, roommate potentially being taped when they have no intention or desire. And it could also result in lawsuits down the road, because those electronic monitoring tapes are required to be kept for at least a year. It also creates a new crime if the RCFE owner is found to have hindered, tampered with, altered with in any way. And that could be the interpretation of someone who doesn't exactly have your best interest at heart. So we are going to be working with the author to try to educate him on these unintended, hopefully unintended consequences on your behalf. So why don't I hand it off? Go ahead.
I'll just add to what Roxanne was saying. I mean, basically, in a nutshell, it boils down to privacy issues and dignity issues. I mean, we have residents that are receiving care in their room. And in the course of that care, they may be nude, they're undressing, incontinence care may be provided. In people's private rooms, private things tend to happen. Residents may express themselves sexually. I mean, it's their own room. And so anything that's a private act can be transpiring in that room. And, the bill, the way it's drafted, I mean, those things are all essentially captured. And then also What about end of life care, like hospice?
Mm.
You know, I don't think it would be anyone's intention to capture someone actively dying. That's just, I think that's a fundamental dignity issue. You know, there's questions about whether residents who have dementia can appropriately even consent to this, whether their healthcare agent should have the authority to consent for them. And then there's also other providers that come in and out of our facilities. You have hospice agencies, home health agencies, EMS, all sorts of people coming in and out. I mean, if EMS is busting through the door responding to a heart attack, are they going to read a sign on the door that says that they're being electronically monitored? And then there's also the security of the footage. So if there's private things being recorded and this is being recorded by someone else who's not affiliated with the facility, what's the security of this footage? And it's very peculiar that the way the bill is currently drafted, that the facility has no say in the matter either. It's basically, it's not a, with consent of the facility, families may do this. It's basically unilateral. If people want to do this, and they can do it without the facility's consent. And I think the facility, better than most people, understand the pragmatic challenges of having this in. And so it's kind of peculiar. And I think it's wrought with privacy and dignity issues. And we are, at this point, strongly opposed to the bill, but we look forward to the opportunity of working with the department and other stakeholders, to work through the issues that are there.
And there's the added additional potential of that very private video or private conversations taking place, ending up at the hands of a hacker and ending up in the internet. So exactly. It's fraught with problems. I definitely think we need to stay on top of that.
Yep.
So I'm Bob Naylor. The second bill we want to highlight is AB 665 by Eduardo Garcia. He's from Coachella. This bill would mandate that RCFEs have a common internet access tool so that residents can engage in virtual meetings with their family members or others. This only occurs if there's internet service already in the facility for business or otherwise for entertainment. We see this as a potential problem because it implies that we might have to supply devices to residents to access the internet. And we have written the author's office saying we would be willing to support the bill if it simply required us to offer the option so that residents could use their own internet device for virtual meetings. We think in this day and age, virtual meetings have been a saving grace for the COVID era, and we'll be on these virtual meetings, I suspect, well after COVID. So we're now opposed unless amended, and we're going to be working with the author's office on this bill.
Yeah, one of the, just to jump in, one of the issues is this notion of the facility providing this common internet access tool, which presumably would simply be a smartphone or a tablet. But one of the issues with that common device and sharing that also is the having to disinfect that device when that device is being shared across residents. And so, and also just the logistical intensity of coordinating the use of the device among residents. It's going to already add to the already the workload, the existing workload of staff to have to coordinate that. There's also privacy issues potentially with data that's left behind when during a use of the device, and then it gets shared with another resident. That data might get exposed. So there's issues there too. We understand the intent of the bill. We like to get to a point to support it. We think that, as Bob mentioned, if those devices are provided by the residents or their responsible parties, then certainly they would run off. They could use the internet that exists in the facility for them to utilize that device. We don't find that problematic. And so as long as the device can be supplied by the resident or the responsible party, we think we can get around to supporting the bill.
Great, thanks, George. So the next bill we want to bring to your attention is Assembly Bill 1300 by Blanca Rubio, who's a Democrat from West Covina. And her bill is sort of following on other efforts that have happened throughout the years. Senator Mendoza had introduced a bill in this area. Assemblyman Ian Calderon did last year, I believe. And the bill is intended to address disclosure and individuals that are dealing with referral agencies. And I had a personal experience where I was trying to find a home and I knew the name and address of a home. And I had to go through multiple pages, Google searches, and I would call thinking I was calling that home, and it would be one of these referral agencies. And if I had pursued it, I would have been captured by them. Unbeknownst to me, I thought I was dealing with a home that was a member of 6 Beds that I wanted to send my loved one to. So this bill is not as strong as the previous bills, and we actually would have liked the other bills to have been stronger as well. But it does start to take the steps in the direction of the intent to protect consumers, requiring and providing disclosure to consumers. There is a provision in it that requires that if an entity receives a 15-day notice to cease contact, then if they receive a notice to cease contact, they have to do that within 15 days. We think if you receive a notice to cease contact, you should cease contact. That should stop immediately. And I think there's some great justification arguments behind that desire. So we will be pursuing that amendment. And I suspect throughout the process, we'll be pursuing more amendments to make it stronger, have greater teeth, protect families that just want to find a safe, clean, appropriate place for their loved one. And so that's been on our agenda for many years, and we will be working hard on this one as well.
Yeah, I'll just add that, yes, the bill's not perfect, but it's I think it's a start and it's a building block for the future. Currently, the space is not regulated at all, zero. And so, having some level of regulation, I think, is a positive. And to Roxanne's point, we do disagree with that provision about the agencies having 15 days to cease contact or cease the relationship. So we're certainly going to push hard to get that amended. We're not happy about that particular provision, but overall, we do think the legislation is a starting point and a building block for the future in this space.
So the fourth bill is SB 648 by Senator Melissa Hurtado. She is from Sanger, near where George lives in Fresno. She is the chair of the Senate Human Services Committee, and that's the committee that almost all legislation dealing with our area goes to. And we've had an excellent working relationship with her, and this bill is very well motivated, but it has some issues. The bill would provide that in-home supportive services workers could come into RCFEs and ARFs to provide services to the residents if they have 75% or more reliance on, help me here.
Okay,
SSI.
so if 75% or more of the residents
Of
are
SSI.
SSI.
Of SSI. Our first reaction to the bill was, how many homes are there that have 75% or more SSI? We think it's very well motivated because they're basically saying, we'll help you out here by sending workers in that the government will pay for in the in-home supported services area. Problems with this could be, do they have the training that are required of workers in RCFEs and ARS? Are they fingerprinted and background checked? Are they covered with workers' comp, or would those go on our workers' comp? A variety of issues. We had an excellent conversation with the staff of Senator Hurtado and the Senate Human Services Committee. We're not opposed to the bill yet. We've raised these various concerns with that staff. We're hoping to work out something that furthers her very noble purpose of helping RCFEs and ARFs who are in tough financial condition survive. There's been an alarming number of closures over the last few years of ARFs and RCFEs that are small and have relatively low income populations. So this is a work in progress. We'll keep you apprised.
Yeah, I'll say, what we're really trying to do is vet the practical impacts and challenges that this bill would present. As Bob said, it's well intentioned, we believe, and but one of the questions that comes up is, what ability would RCFE or ARF operators have to actually direct the actions of an IHSS worker? Technically, those IHSS workers work for the beneficiary, who's the resident. So the resident, in theory, would have to be the one directing. But how does that jive with a licensee who has the legal responsibility to operate the facility? So there are, myriad practical, I think, challenges and considerations that need to really get fleshed out. Part of the idea of the bill is that facilities will save money on staffing by using IHSS, and then those savings will then be used in areas to help improve the facility, like the physical plant, for example. So one of the questions is, well, how much savings are expected from this? Just how much of an impact? And would community care licensing even be okay with licensees reducing their own staff, basically substituting their own staff for IHSS staff? I mean, we don't even know if that would even fly. So there's a lot of, I think at this point, more questions than answers, frankly. Again, like to Bob's point, we think it's well motivated. We understand the problem. We agree that there's a problem with facilities closing down who are mostly taking care of SSI, SSP residents, and we agree that a solution is needed. And we're not opposed to the bill at this point. Well, we're not supporting the bill either at this point. We're trying to basically flesh it out, and we'll continue to monitor it and keep everybody apprised.
So the process now is these bills will be heard in one or more committees in both the Assembly and the Senate. Roxanne and I, sometimes George, sometimes other board members will testify on these bills. We will attempt to either get some dropped that we don't like or amended to our satisfaction. And this process will last through the end of, until actually mid-September, at the end of this first year session. But there's another process that's going on in parallel, and that's the budget process. And there are a couple of interesting proposals in this year's budget, which we've already talked to the Department of Social Services about. The governor proposed $250 million as a grant program for counties to either assist in deferred maintenance or actually even acquiring facilities threatened with closure, ARF facilities primarily. And the idea, again, is to stem the tide of the closures, which has been especially intense in San Francisco and Los Angeles, where the costs are so very high for operating, for real estate and so on. We're not quite sure how this is going to work. It's going to be grants to the counties, but we suggested that the real problem of closures is not deferred maintenance, it's the operating costs exceeding what's available in the SSI grant in particular. And counties are, in some cases, supplementing those grants, and the state could perform a role in supplementing the supplements to help pay a higher per resident rate to really, as a practical matter, be able to operate these facilities and have the business plan pencil out. George knows more about that than anybody because he operates a bunch of facilities and has done financial analyses in some of our past lobbying efforts. George, maybe you want to comment a little bit more on this particular proposal.
Well, yeah, I think you hit it on the head. It's not just about fixing, the existing physical plant that may be in disrepair. We have to ask ourselves the question, why did it get to that point in the first place? And the reason it got to that point in the first place is because there was not enough revenue coming in to pay for all the legitimate business expenses that are there and that are increasing over time, and to then reinvest money into the physical plant and other areas of the facility. And so simply providing one-time funds to fix things up and bring them up to a certain level without a bigger picture solution will just lead to those facilities again going down the road of getting into disrepair or not having adequate funding to pay for their expenses. And so, it's we're not opposed to the funding, but we're glad that it's being considered in this manner, that there's so much attention on this issue compared to the past. I mean, we've been talking about these issues ever since our existence, and not as many people were talking about this issue then around 2014 and 15, and now many more people are talking about the issue. So the fact that this conversation is even being had in the legislature through the budget process, I think, is a big positive. I just think that we all need to come together and think about what are the big picture solutions, what are the sustainable systemic solutions. And so, to Bob's point, we'd like to see the income, the revenue on the revenue side having a sustainable source in order to really make these one-time payments for improvements count and for them to stick. And so that's what we're working towards and engaging with other stakeholders and the government and our partners on.
Yeah, and the budget process requires hearings on each budget proposal in both the Assembly Budget Subcommittee and the Senate Budget Subcommittee. Roxanne and I have been testifying before those committees. There'll be a May revise and another set of hearings. That's a new revenue estimate and a revision of the budget that the governor offers in May after the income tax revenues come in April. And so it's a parallel process with the bill consideration process. Thank goodness there are two of us, because there are a lot of bills and a lot of budget items to cover. And we appreciate working for 6Beds, and we think this is a very honorable cause. But a lot can go awry in the legislative process if you don't have somebody watching. And your board of directors and Roxanne and I are watching very closely. And by the way, Roxanne, maybe you want to close this meeting by talking about the lobby day on April 7th.
Absolutely. And I guess before I talk about that, I want to stress the importance of you having a voice in the policy world, reaching out to your elected officials. You can Google, you'll find My Legislator, use your zip code, and they respond to constituents. They want to hear from their constituents. So if you hear about something from us that we need to get their help with, you're developing those relationships and making those inroads. You become what we call grassroots, your voices out in the field. And we're much more powerful and stronger as an organization with members getting involved as well. And so one way you can get involved is our lobby day, as Bob mentioned, on April 7th. You'll be receiving information and a link to it, but we will have a number of legislative leaders participating. We'll have representatives from senior representatives from DSS, from DDS, from Ultra Regional Center. And I've got to say, in reaching out and asking these folks to speak to 6Bed members was not twisting any arms. They love the service that 6Beds provides to communities, and they value it, and they want to help you grow and thrive. And so participating in the lobby day will both identify those folks for you, but also give you more information about the issues and bills and maybe regulations that could have an impact to you and your business. And then we can arm you with the tools and information to go back to your district and start influencing those policymakers where you live and you work.
All right. Well, thanks, Bob and Roxanne, for helping me give this update to everybody. And I hope all of you watching will join us for our lobby day, and stay tuned for that. And also just want to remind you that please consider contributing to support our legislative advocacy and public policy operations. With the email for this webinar, you should see a link or a button that says something to the effect of contribute now. And you could make a big difference in helping us. Anything that you can provide, it will be helpful to us, and we will certainly appreciate. So thanks for joining us, and hopefully you'll join us for Lobby Day, and stay tuned for more updates. Thank you.
Thanks.
Thanks.